All right, I'm going to call the meeting to order, if that is okay. You're good?
Yes,
You're good?
thank you.
All three doctors are here. Hi, Stephanie. Can you hear me?
Yes.
Great. So we'd like to call the board to order, and the first item on the agenda is Bobby to read the thing.
All right, so the Board of Health meeting today is February 9th. We are meeting at 18 Mulberry Street and also via Zoom. The meeting ID at Zoom is 863-9978-9686. Passcode is 271193. Folks can also join us by telephone 1646-876-9923. And if anyone has any problems with the audio, we have a number for folks to call, 603-821-2049.
You good? Thank you, Bobby. Before you, for the old minutes, we have two of them. We have January 12th, which is regular meeting, and January 19th, which was our special meeting. Looking for a motion to approve those.
Yes,
Motion to approve. Stephanie, can you hear?
Yes.
Motion to approve the previous minutes.
I will second the motion, but I would like some discussion, please.
Sure. No problem. Okay, so the motion is on the floor. I open it for discussion. I'll open, let's do this so I don't get too confused. Why don't we do January 12th, the first one? Is that okay?
Yes.
Okay. Well,
So the one recommendation that I had that resulted in an amended set of minutes being set out was it listed the recommended masks as K95, and I wanted to clarify. So there are two masks that are 95% filtration. One is N95, which means it is approved by US powers that be, and the KN95, which is a Chinese quality control. And they are considered basically equivalent if they've met those standards, but either one would be acceptable. So I appreciate that change being made.
thank you. Any other recommendations or house cleaning on the 12th? Seeing none, let's go ahead and vote that one. For approval with recommended amendment by Stephanie. Those,
yes.
go ahead. Those in favor?
Hi,
Thank you. Those will be passed as amended. Number 2 is the January 19th meeting, which is now on the floor to talk. Any discussion?
So I just would like to point out that much of those minutes, in contrast to the January 12th minutes, are more of a transcript, but a partial transcript. And I much appreciate that, an attempt was made to include as much as possible, but I'm still remain a bit confused as to why those particular minutes read more as a transcript as opposed to a summary. In an extended meeting, it can be very difficult to synthesize the back and forth into conclusions. And so I don't want to spend a lot of time on the minutes, but I am concerned that they do not follow the same construct as other minutes that we've done. And I think it does lead to some confusion. So I have a level of discomfort with the way the minutes were done. I know there were honest attempts to make sure that there was enough included that people could understand what was in the meeting, but they are recorded if people want more details. So I just wanted to bring that to attention.
Okay. Bobby, you want to address that because you were the transcriber?
Oh, yes. So, yeah, I did. Thank you, Dr. Sters. I did, was the scribe at that meeting and recorded the notes based on the Zoom meeting itself. So that's why the format looks different because I did the note taking, Dr. Stephanie, instead of Fokia.
And I commend you because I think there was a lot of information at that meeting. I just think for purposes of people trying to understand what's at the meeting, that a transcript that isn't a complete transcript can be confusing at best. So I will endorse the minutes as they are written, but I would strongly recommend that in the future that they follow the other content patterns so that clarity can be provided in a summary fashion for those who so desire, and the full recording is available for those that wish more detail.
Okay, thank you. Maybe that would be, well, hopefully we won't be in that format again. That would be one thing. But if it is, we'll make sure that there's continuity, that there's consistency, so there won't be any confusion. So thank you for bringing that up. Any other discussion?
No, I second Stephanie's comments there. I think it's just important that it isn't a he said, she said document, and then it becomes more of a 30,000 foot view picture rather than the individual stuff, because then it becomes maybe misinterpreted or something. But no, it's a fair and respectful. We've had this discussion a few times, so if we could get back to the way to do it in the past, would be great. Thank you.
Good, thank you. Would you care to vote on these now?
Yeah.
Any other discussion on these? No. Okay. Those in favor?
Yes.
Thank you. Approval of those minutes. Bobby, would you make sure that the aldermen that are present are recognized?
Yes, I do. We do have with us Alderman Timmons. We have the Alderman Como, and we have Attorney Steve Bolton, and I believe that's it.
Okay, if we've missed somebody,
I'm looking to see if Alderman Melbourne is on.
I don't see him.
I think that's it.
okay, good. If somebody does pop on, then we can also add them to the list. The first thing would be, Bobby, well, we're going to do department summaries. We talked about that to make it a little bit more streamlined and also more helpful for the staff. So you are up with the director's report, please.
Did we want to do the situational update first?
I could. That's fine with me.
It just has the data.
Yeah, I can just switch the arrow.
Okay,
That's fine.
so do you want to go ahead with the summary?
Please do. Thank you.
All righty, so I will go ahead with the director's update, and it does include the just some high level points from community services report, and we have our vision and mission statement that's there. Just briefly, the only financial update that we've had is that we've had some funding, additional funding coming through from the CDC through a cooperative agreement for workforce capacity that will allow for us to hire a public health equity physician and also support summer student interns. We haven't had student interns that were paid in the past that weren't from the high school, so this will be college level students that can apply for that. And then I also included in this report the policy update. There were two public hearings this week. One is actually scheduled for, one's already passed and one's scheduled for today, since we do these, last week. So those are the two. And then I also included some other bills that would impact public health. And so there's a list of bills that are there with a brief statement about each one of them. And in your Board of Health report, you also received the longer list of all of the bills that impact public health, environmental health, welfare as well. With regards to the community services reports, we've had our second statewide booster blitz was held back in January, where we had most of the staff participate on that. We had a second one that was done at Revere University. And the main focus at the time is still getting vaccinations into arms. And so we look forward to opportunities to make that happen. And you can see that is identified there. Under behavioral health, we did have some staff complete a mental first aid training, so that now they are trained to train the trainer, so that we can offer some of those trainings in the community. We did host our legislative breakfast. We had 47 attendees attend on the 24th, and this is where we had a chance to present information on behavioral health. And we actually had two community members speak. One was a student, and one was an individual that was in recovery from substance use disorder, and that was very informative. From Lindsay, she continues to do the epidemiology, our COVID monitoring, and we'll present our situational update, those numbers a little bit later. She's now working on the next phase of our Cresty Equity Project. We're looking at interviewing some key stakeholders in our clinical setting, medicine and dentistry, on addressing issues related to trust and with the community members, and follow up to a couple of listening sessions that we had with community members. In public health emergency preparedness, we continue to work on the compliance for reaccreditation, as well as getting our medical reserve corps all registered. We found out that we have quite a hefty list of folks, almost 500 individuals that have volunteered with us over the course of response for the pandemic. And so we're trying to integrate all of those folks into our database. And we've re-engaged our community emergency response team as well. For our public health network services, we are really excited because then you should have gotten an invitation. We have our 8th annual public health advisory meeting scheduled for tomorrow at 9 o'clock. And we're finishing up our chip. And so those are the updates from all of the programs. And so we just gave, again, the high level. You should have a full report in your packet of all of the work that folks have done as well. With regards to staffing, we have that position that's open for that public health equity officer, we're hoping to fill. We do have some medical students that will be joining us on the 28th, and then we have several public health interns that will be joining us in March. And as far as staff development, Patrick has made sure that all of our staff are receiving our NIMS, which is the incident management system training at the national level, and our incident command structure courses. And we did a training, diversity, equity, and inclusion training back in, it was over a period of 6 months. And so there were some book recommendations that were made and they were provided to the staff. And those are the highlights of my report.
Thank you. Any questions for Bobby? Yes, Chuck, Dr. Chuck.
Bobby, thank you so much as always. Can I ask about when public hearings about your House bill, particularly this week, 1035, about unvaccinated kids being allowed to go to school or exempt from having them done? Does it, just as an FYI, more informational, is if you see something that's kind of a highlighted one, would you, do you have a network of people that you maybe say, hey, you know, maybe we need some help on this? Because that one particularly was pretty close to my heart. If it's too late to, you know, commit to something, it's too late, but if maybe just going forward, I'd love to help on any pediatric concern, because that really would be a game changer too for schools and all of us in public health.
Right, and so this what happened with these two is that our legislative agency, New Future, pushes these things out, and then they send out for, and I'm not sure if Dartmouth is on their list or not, but they'll send out messages for people to to log in so that they can send responses out, so they did do that. So if you want going forward, when those come through, I'll just make sure that they go out to the Board of Health ahead of time.
Thank you.
And the Medical Society sends some occasional things, but I don't.
They didn't send this one, because this is gonna impact all vaccinations. This is not just related to COVID vaccine, this is everything. And so we have required vaccinations for kids getting into school, and this bill would make it so that the parents didn't have to get their kids vaccinated for school. And we know that there've been outbreaks that have occurred when kids haven't had their vaccines, especially we saw some with the measles and so we just want to make sure, that we do stay on top of that. So they did have some testimonies and they rallied quite a few folks. So, but I'll make sure that you guys get these. We won't just put it in the report. We'll make sure that you guys get these ahead of time.
Okay.
And so that's why I include that whole list.
Great, thank you.
All right, thank you for that question.
And Bobby, are you done with your
Yes.
presentation? Sorry. Any other questions for Bobby? Stephanie, you're good. Okay. Thank you. Is Jane or Kim presenting on community health?
Kim is here.
Okay. I didn't see her.
So Fokia will have to unmute. You have to ask Kim to unmute Fokia so that she can present her report.
Hi there. I'm
Okay.
unmuted.
I see you up there. I
Good
apologize.
afternoon. Well, Kim Bernard, I'm the Chief Public Health Nurse for the City of Nashua under the Division of Public Health and Community Services, and I'm reporting out on February. So during the month of January, Community Health Team has continued to provide all of our programming services to the community, including the COVID vaccination guidance, messaging, and education. Just to highlight a few trends from December to January in terms of COVID, cases increased approximately 100%. Clusters and outbreaks increased by approximately 53%, majority reported in the schools. And changes to COVID reporting has also taken place starting the beginning of this month, so 2/5/22, so it just occurred, that all K through 12 colleges and universities will no longer be reporting individual cases. They'll be aggregate reporting only. Childcares and businesses will report clusters and outbreaks, and there's been no changes to long-term care facilities in terms of reporting. We have continued with COVID vaccination strategies to reach unvaccinated and vulnerable populations. We've added Friday outreach clinics in the afternoon, and we've been able to serve many clients out in the community, many that hadn't even received their first vaccine. The total immunizations, COVID, including COVID and all our immunizations during all our clinics in the month of January was 936 vaccinations. Of that, 87% were COVID, and of that 87%, approximately 13% were to 5 to 11-year-olds. Shifting gears a bit are some other things to add on some of the other programming that we do. In lead, we were trained by the New Hampshire DHHS on a new database system called HELPS, HHLPSS. And you may remember that I was covering as the coordinator for the lead program during COVID, but Tricia Glassetter will be taking that back over as lead coordinator. We have also, our staff has also been attending homelessness training and including some point of time training and the count that recently occurred. Updates. We do have some nursing students with us, undergrad students from Riviera, as well as some nurse practitioner students. We do have a per diem grant funded physician who is hired, and she is working per diem in our sexual health clinic. We also have a full-time grant funded disease intervention behavioral health public health nurse who recently started, Liana Perez. And we also were able to hire a full-time temporary CDC Foundation public health nurse, which is a contract through the New Hampshire Department of Health and Human Services through the CDC Foundation. And that nurse is with us through 7/31/22. Her name is Jonna Martin, and she's actually on the call today. And that is about it for community health. I'd be happy to answer any questions.
Thank you very much, Kim. Any questions, Dr. Stephanie, Dr. Chuck? Thank you.
Thank you.
Moving on, Heidi, environmental health.
Okay, you have to ask Heidi to unmute, and then once you see that Heidi, she'll unmute you.
Hi, Heidi. Can you hear us?
Okay, excellent. Thank you, Fokia. Good afternoon, all. Heidi P. Kokoka, Nashua's health officer, also the manager of the environmental health department. And I'm going to go over our monthly report very briefly and just touch on some highlights. We continue to see that our failure rate for routine inspections of food service establishments continues to go down, and that's very good news. And we're very gratified to see everyone working hard to comply with our ordinances and the state food code. Fokia, could you go to the next page? Thank you. One of the complaints that was a little alarming to us came in through New Hampshire DES, and that was a pool complaint from a family who had experienced chemical burns from a pool. And so we had the gentleman from DES come down. We went out and checked it out as well. Sometimes these pools are controlled by automatic feeders and automatic measuring devices. And this one, the probe was broken. So it lulls pool operators into a false sense of security, thinking that they're all set, where the chlorine level was actually way too high. So we'll continue to work with that facility, but these things happen from time to time. I'm glad it was a savvy mom who caught this and reported it, because it is good to know, and it's good to make a definite change for anyone else within the pool. Next page, please, Fokia. Thank you. We are going to begin to track our revenues in the Board of Health report every month. And at this time of year, we're only collecting our food service revenue and our septic revenue. And the septic is really tiny compared to the previous fiscal year. One thing to note is that our revenue is pretty, it's a little bit higher than the last fiscal year. We're seeing an awful lot of change of ownerships. And that has continued through the pandemic, but we'll be watching it. And what we'll do when it comes to the end of the fiscal year, we'll give you a pie chart that will show you our pools and our spas and our solid waste haulers as well, just to demonstrate what kind of revenue we're bringing into our department. As far as our legislative updates, I wanted to touch on a few things real quickly, and I'll try to go fast here. You got the communication regarding the House Bill 1272, limiting the authority of health officers, and that we haven't seen the amendment to that, but the prime sponsor said that she had changed the language pretty significantly, but it's still not it's not out there yet. But the thing that is critical here is House Bill 1268, which limits the authority of city council bylaws and ordinances. And so it's good for the Board of Health to be aware of this, and if they were so inclined to offer up their opinion, because this would have certainly limited any of the emergency actions that were taken over this past couple of years. And so the hearing for that one, 1268, is on the 15th at 11:30. And then, let's see, I stopped writing notes on some of these. House bill, there is a bill for milk pasteurization that includes raw milk, ice cream, and frozen yogurt. And we're concerned about children and the elderly are vulnerable populations consuming that. And I think that that just passed with an amendment with pretty much a warning that it contains, that the products will contain raw milk. So it's kind of buyer beware, I assume is the philosophy for that. There have been a couple of other initial hearings. One is relative to establishing a statewide food truck license. We're concerned about that because we don't want to relinquish our right to inspect when they are in our community. And that has just had its initial hearing, as well as the push carts with condiments. There's also establishing a committee to study regulations. And then the one requiring the food allergy awareness procedures, that was referred to an interim study. And they're going to use a rule process instead of the legislative process. And then just a few more of them. The dogs and outdoor dining should be familiar to you guys with what we've done in the past. That passed with amendments, and it was very gratifying for me to see that the language that they used was the same language that's was in our waiver process. So the same things will be addressed that we had called out. Let's see. And then there's one bill for Kratom that's scheduled for a hearing on the 16th. And that's been referred to an interim study. And then hemp products, House Bill 272, that passed with amendments. And let's see, I'll just skip through the rest and see if Ren has anything to add to this. We are revising our job descriptions and hopefully going back to environmental health 1 and 2 to try to hold on to staff a little bit longer and provide them with a growth opportunity, but also to reward them for advanced education and training. And let's see, there are COVID activities, and then we've met to discuss outdoor dining for this upcoming 3 years. Ren, is there anything you would add to this?
Good afternoon, everyone. Ren Bowden, Environmental Health. I would just add one thing on the pool program. As Heidi mentioned, there was the issue with the family with the chemical burns. There have been a lot of changes in the pool RSAs, the state laws, as well as the administrative codes this past year. So expect to get some updates on those changes in the upcoming months. So we'll be looking at a critical look at our pool program and doing any updates as needed with the new RSAs and stuff that will impact us. The reason being is because of the Legionnaires outbreak that happened back in 2018 at Hampton at an unlicensed spa that was linked to 49 people getting sick and linked to 2 deaths. So the recreational water quality is a huge concern in the state, and there are over 1,400 licensed pools statewide, 100 of which are in Nashua. 80 of those are seasonal pools that are essentially open during your summertime, and about approximately 20 of them are in your sports clubs and your hotels that are open year round. So this particular one was in a hotel with the chemical burns that we had here. And as Heidi said, the chlorine levels were exceptionally high, again, to a point where it was causing chemical burns on the actual bathers. So we did get that under wraps. We identified what the issue was, and we will continue to work with this operator. But there are going to be changes at the state level that are going to require certified pool operators at every pool. So we will be getting our pools, our 100 pools, up to speed on these new laws over the next several months as we move into that season. And that's all that I have. Thank you.
Thank you, Ren. Thank you, Heidi. Any more, Heidi, from you?
No, thank you very much.
Good. Any questions? None from Stephanie, none from Chuck. Thank you very much. Moving on, I'm going to kind of add in some things here. Lindsay, would you like to step up to the plate?
Sure.
Thank
Good
you.
afternoon, everyone. So I'm going to report out New Hampshire COVID-19 statistics and then followed by Nashua. So there has been a total of 284,567 cumulative cases since the beginning of the COVID-19 pandemic. The average number of cases reported daily is 779. And there's a 39% decrease compared to the last recent 7-day reporting period. There are currently 5,284 active cases for New Hampshire. There has been a consistent decrease in active cases since February 2nd, with 43% decrease since that day. There are currently 185 hospitalizations in New Hampshire and a consistent decrease since January 25th. Over the past week, there has been a 37% decrease in the number of hospitalizations in New Hampshire. There have been 2,277 deaths reported since the beginning of the COVID-19 pandemic, and over the last week, 47 deaths were reported. As for New Hampshire residents, 56.2% are fully vaccinated and 62.8% have received at least one dose. Something to be mindful of is that this number does not reflect the vaccines given at pharmacies, as DHHS does not have access to that data at this time. For New Hampshire's 7-day positivity rate, it has been consistently decreasing since January 13th, where we saw our highest number of active COVID-19 cases. The current 7-day positivity rate is 12.8% with an average of 7,211 tests taken daily. Moving forward, DHHS will no longer be collecting data on at-home tests. According to Dr. Chan at DHHS, they're working on reporting a backlog of cases that go back several weeks in January, and those cases will only be reflected in total case count instead of the active cases. For Nashua statistics, there has been a total of 20,235 cases since the beginning of the pandemic. There are currently 337 active cases. There has been a consistent decrease in the number of cases since February 2nd, with an overall 40% decrease since that date. There have been 136 deaths reported since the beginning of the pandemic, and 2 were reported within the last week. 53.9% of Nashua residents are fully vaccinated, and 60.7% of residents have received at least one dose. As for schools, DHHS is updating their requirements for reporting. So as Kim mentioned earlier, they're only going to be reporting aggregate data weekly. So as of right now, I do not have any data for schools. As for Southern New Hampshire and St. Joe's Hospital data, there are currently 22 COVID-19 positive patients. 77% of all inpatient beds are occupied, and 95% of ICU beds are occupied. And that's all I have. Thank you.
Oh, thank you, Lindsay. Any questions or comments? Dr. Chuck?
Thank you. On the last two about Southern and St. Joe's, 77 and 95%, is that, can you help us with what maybe it was before? Is it higher, lower, or the same? Roughly?
A little bit lower. It hasn't decreased a ton yet. If you look at the New Hampshire Hospital Association, they track, I think, 30 different hospitals, and there is a decrease,
Okay.
Which is good. And that's what Dr. Chan reported to earlier this week, is that we are seeing consistent.
Thank you.
Dr. Stephanie? You're good? I think you're on mute. Okay. Seeing no questions, let's continue. Patrick, is he going to be giving?
No, what was asked was that the community services report
Right.
sort of be
Sure.
compressed, and so the high levels of the activities, but their individual reports are in there for
Gotcha.
if there's questions that folks have about anything else.
Sorry for my confusion. The next one would be Bob Back, I believe, for welfare. See his name up there before.
Yeah, Bob is there. Polkia just has to unmute him.
Okay.
I think, Bob, you can unmute yourself.
Maybe Bob's not in.
I'm calling.
Oh, thank you. Still on the hotline. Poor guy named run to the bathroom.
Well, you know what? Sandra is there. Polkia, if you want to unmute Sandra, I think the report is there.
Oh my God, he's always there. Guess what we should do.
I did ask Sandra to. They can unmute themselves.
Okay, so you can, because neither one of them will answer that.
Okay,
If you want to.
you want to give them like that? You have one?
Polkia, are you able to share the screen?
Sure.
Hi.
Hey, Bob.
I'm sorry, was I called on? I had to step away for a
Oh,
little
no
bit of
problem.
emergency
I figured you were
situation.
busy. Yeah, I
So,
figured you were busy.
I apologize. Yes, Bob Mack, I'm the welfare officer for the city of Nashua. Just overview of the statistics for the welfare department for the month of January. You can see a slight decrease in the expenditures. That's primarily due to a reduction in requests and need for shelter and rental assistance as we continue to refer clients to the Southern New Hampshire Services Emergency Rental Assistance Program that is still operational. Other than that, the expenditures are no real significant changes. Could move to the next page, Fokia. And the numbers as far as contacts, interviews and decisions and percentages of those who applied and received assistance was fairly consistent compared to last year at this time. And again, you see a reduction on the first line for shelter vouchers, rental assistance vouchers. The department continues to refer homeless cases through crisis assessment and referral and continuum of care local agencies within the community. Staff also participated in the annual point in time count that took place on January 26th through the 27th. And that is a coordinated outreach effort to try to capture some numbers on the unsheltered homeless within our community. Those numbers were counted, and the information is being put into the HMIS Homeless Management Information Systems data bank for assessment and evaluation and deduplication, and then that information will be published sometime, hopefully in the not too distant future. We could move to the next page. We continue to work with our community partners, as I mentioned, referrals to the Southern New Hampshire Services COVID Emergency Assistance Program, as well as their mainstream fuel assistance program during this time of year. There is a winter moratorium on disconnects for heating assistance. That does not mean people cannot get shut off, but it's a little more difficult for them to be shut off. And the payment arrangements they're able to coordinate are much more flexible during this time of year. So we work with folks, primarily a lot of folks applying for fuel assistance are coming in so that we can help facilitate extended payment arrangements for them. It's also income tax season, so we also refer clients to the volunteer income tax assistance sites so that they can get free assistance in completing their income tax returns. At this point, we've expended about $183,000 of our general assistance budget, which is about 38% of the budget for the current fiscal year. We have recently proposed an update to our financial standards, which are the costs on which we make our eligibility determinations and issue assistance. This is based on the Consumer Price Index, as well as the USDA food allowance standards and the New Hampshire Housing Finance Authority residential rental costs survey. There wasn't a real significant change as far as the rental costs, actually, some slight increases in some of the categories, but the inflation costs, the cost of living for some of the expenditures had about a 7% increase based on that CPI data. The financial standards have gone to the Board of Aldermen and have been referred to the Personnel and Administrative Affairs Committee for next month, for March 7th. And that is my report. I don't know if there are any questions.
Thank you, Bob. Any questions, Chuck? Stephanie, any questions? Stephanie's good. Thank you very much.
Thank you.
You're welcome. Thank you. Bobby, any other information in this section?
No, only other thing is that I would just reiterate, we are, for that Public Health Advisory Council, we are extending that out to the public, and so they can register by going to our website, and there should be a link on there for folks to register. We'd like to have our community participate in that annual meeting as well, to hear about some of the work that has been done. Over time, we usually plan on getting that health assessment done, and then the community health improvement plan done over a period of time. But of course, we've been engaged with something that was very distracting, but was a great public health effort. And so even with all of that has been going on, we've been able to accomplish getting that community health improvement plan done. So we'd love to have community participate in that as well. So they can go on our website and click on the link for the go-to meeting and register.
Okay, thank you very much.
And we're looking to see the little clip from you too as well.
I was asked, but I'm teaching a student tomorrow.
Thank you, Stephanie, for registering. So we'll see Stephanie tomorrow.
That ends this section, and I now open it up for public comments.
Oh, there was supposed to be one of the things that was also the conversation about revisiting the mask mandate was a part of the general discussion of the board.
I was going to put in the public comment.
Yep, okay.
Open discussion then regarding the ordinance, the mask ordinance. As is, we are ending it at February 28th.
Correct.
Stephanie, any questions or comments? Or I do like the fact that the numbers are going down significantly, which is good. Will they go down where they're safe enough? I don't know. I'm just trying to predict the Super Bowl right now. So it's just, you have to wait and see. I don't see us extending it at all, period. I think the 28th is going to be the end, and I would ask everybody to just be patient and continue to wear them. And let's see if we can help our community get safer. I was just on the, I would invite people to go to the CDC website for statistics, and just do CDC, and it'll come up, and then just write in statistics. And you'll see the graphs, and if you look at the graphs of this part of the pandemic, if you look at the first part of COVID, you'll have these little bumps, basically. And we're getting a surge, we're leveling out, getting a surge. And then when Omicron came, it was like a rocket ship blasting off. If you look at it, it goes straight up. And it's higher than any of the other peaks altogether. The deaths, I mean, like divided for cases, deaths, all the way down. There's 9 categories that you can actually print out the graphs. And anyway, it has peaked and it is coming down. It's coming down significantly, and that's why I'm very optimistic that we're getting healthy. And we're hoping people that I've talked to, who know a lot more than I do, feel that this will be more of an endemic by spring, which will be translated into like the common cold or the flu. How we handle it from there, I don't know. But basically, I'm really, really hoping that this is the end of it. And I remember a few years ago, they were saying this would be around until 2022, and we all laughed. And we all said, it's not going to happen. And it did. So sometimes it's bad to be right. But anyway, I now would like just to open it up to public comment and light up the board. I see 2 hands.
All right, so for Kia, for the hands that are raised, you have to allow for them to take themselves off mute.
There you go.
Do you usually recognize people in the chamber?
I'm sorry, I didn't see your hand up. Okay, well, take you first while I figure that out.
I'm very concerned about the messaging of this board. I really am. I think this mask mandate and the fact that you're lifting it on the 28th, I'd like to have a discussion with you folks on the effectiveness of masks, because I don't want to see them come back ever again. I disagree with you all wholeheartedly that they did the trick, because you can produce no local data for that. When you tell me to go to the CDC website, that's a national site. I want to know about what's happening here.
It does do that for the city.
Okay, and there is too many articles coming out that we are reading now about this and the ineffectiveness of it. And the fact that we didn't even have a buy-in on this city to do this. You don't know. I've been into stores where I walk in without a mask. There is no enforcement going on. What was the effectiveness of that? Number 2, I'm really concerned that such an educated board of health, one, I can't get your resumes. I didn't even realize that. I'm being told by a member of the Board of Aldermen that we have 1 or 2 epidemiologists. I don't even know that. When I ask for the resumes, they don't exist. I have to go on LinkedIn and figure it out. I just went to the public service community affairs meeting, and they've got the resume for the Conservation Commission person and the dog park lady, but we don't have them for our Board of Health. That just seems wrong to me. Dr. Capetta, I am so disturbed by your messaging of fear and citing a child who died. I cannot speak strongly enough against that. I do not know why we are pitching vaccinations for children.
So 1 more minute.
I think it is fine to pitch vaccinations for older people, but for children, I almost think it's a crime now. I don't know why we're pushing boosters that are 2 generations back that don't meet this. And Dr. Wolf, I am thoroughly disgusted with you and your messaging to the public, because you haven't given us answers. I don't know why you guys didn't hold a forum where the public could question. We've never been able to question. I've had to do all my research on my own. And I feel you in particular are beholden to the profits of hospitals, given your background, rather than the interests of what your community is looking for.
All right, that's time.
Thank you.
Thank you. Yes, I think Laura was up first.
So yeah, so for Kia, are you able to, so if you see the thing that says you can unmute, and you just click on that, then you can unmute yourself.
They have to unmute themselves. I can only mute them.
Right.
So so Laura is on.
My name is Laura Cohen and I'm 30 Greenwood Drive. I think this board is a sham. I am so tired of hearing about the entire state of New Hampshire. I want to hear about what's happening in Nashua. And as you know, our hospitals are getting patients from all over the region down here, not just Nashua. So why can't we get figures on Nashua residents and not the state of New Hampshire? I think this mask mandate is absolutely horrible. I think it's horrible for the children in the schools. As far as the vaccination for children, I think you guys, it's child abuse to these children. They have to live their lives, and you're putting this crap in that we don't even know what it's all about. But you want people to put this stuff in their bodies, and nobody has said all the problems that have happened to people that have had these shots, that have maybe had blood clots and everything else like that. So you know what? I think you all better go back to school because you need an education on masks. Thank you.
Alderman
Como?
Alderman Como, you have to unmute yourself.
Thank you. I just wanted to first note for the record, since you took attendance, I believe Alderman Govea and Alderman Klee are also in attendance.
Thank you.
I was wondering if I could get a little bit of clarification on some of the numbers that were spoken about a minute ago. It said that 95% of ICU beds in the two hospitals were occupied, but I'm unclear whether that means they're occupied by COVID patients or if they're just occupied. Does that include people who are in because of car accidents and things like that? I also don't know how many ICU beds there are. So when I hear numbers like there are 20 people in the hospital, I don't know from the outside what kind of percentage that represents. So I was wondering if in future meetings we could break those numbers down a little bit more. And then I just wanted to ask a question so that I'm clear. When you talk about the mask guidance, are you saying that you're not providing any new guidance at this time and you're expecting the existing ordinance to expire as written on the 28th, or are you sending an updated recommendation to the board to do anything with the existing ordinance?
The expectation is that the ordinance that we have in place will expire on the 28th as it was written.
And we can, yeah, we'll find the numbers for,
Okay.
you have, she has.
Yeah. Hi, Alderman Como. I just wanted to say, as far as hospitals go, so the way the ICU beds are reported out, they don't differentiate between patients whether they're COVID positive or negative. I think it's just in terms of what kind of resources are being used. So when I last looked, 19 out of 20 beds were being used between both hospitals. And same thing with the inpatient beds. There was no differentiation between COVID positive or COVID negative, just more of a sense of what resources are being used.
Thank you, Lindsay.
I just want you to know I'm getting messages that the audio is cutting in and out really bad.
Okay. Thank you.
So we'll make sure that we speak up in here so that you can hear. Can you all hear me pretty clearly? If you, yes, so we'll just make sure that we all speak up in here. All right.
Next, I think is Lou.
Paula.
Oh, I'm sorry. Sorry, Paula.
Paula, you can unmute yourself.
Okay, good afternoon. My name is Paula Johnson. I'm a member of the Board of Education. I'm speaking in behalf of myself today, not as a member of the board. I'm a little bit shocked and appalled, excuse me, by all these mask mandates and ordinances that we have to put up with. If you read the CDC guidelines and it talked about people with disabilities who could not wear masks, you know what? It did not say that we had to provide notes and show that we have a disability. I have been discriminated against in this city regarding that I have to bring in a note showing that I cannot wear a mask. Some people think it's funny. I don't think it's funny at all. CNN had Dr. Lena Wen on there talking about there was and is a time and place for pandemic restrictions. But when they were put in place, we were always with the understanding that they would be removed as so as we can. And in this case, circumstances have changed. She then goes on to say, and so in this case, I'm not saying, but I don't think anymore really is saying that no one should wear masks, rather than the responsibility should not be on government. You hear this? Government, but imposed on people themselves. So here we are, a doctor that is with CNN. I mean, government has to get out of our lives already. And I also want to say, because I know my time is going, when we have cases versus active cases, there's two different things. And I'd like to know, what testing are we using at Crown Street? Are we using the PCR test, or are we not using the PCR, since that has been banned by CDC? So, and also one other thing is, city employees, their faces should be up so we can see who we're paying for here, that they shouldn't be blacked out. Thank you very much. And again, enough is enough with these masks. And I've walked into stores and they don't say a word to me, but I also walk in with the ordinance and my letter that people think that never existed, but it actually does. Thank you very much. Have a wonderful day.
Thank you. Lou, you can unmute.
Good afternoon. Hi, Lou Juris here, and I'm on Haines Street here in Nashua. I just want to thank the staff at Public Health and the doctors and all the people on the board for keeping us safe these past couple of years. And the masks do work. They act like both a filter and a muffler. And I've, in my experience lately walking around, I've seen a lot of people wearing them indoors. It'd be nice to maybe have it pulled back a week if possible, but that's probably going to depend on the infection rate in the for 100,000 here in the state as well as here in the city. Also want to thank the Board of Health for doing the work that they do in the community for additional shots such as flu, for monitoring restaurants, rental assistance, and of such. So most importantly, maybe right now, we need to give our healthcare workers in the hospitals and our long-term care facilities a little bit of a break. The hope is to
1 minute.
Have this thing wind down and let them take some time off, let them rest up. And hopefully, like was said earlier, this is the end, that this is the end of, it becomes endemic. I appreciate your courage and your strength in putting up with some of the commentary and some of the vitriol. I've been experiencing a lot of it the past year too, and hang tough, keep doing the good job, and let's hope that these infection rates go down and the deaths go down. Appreciate it.
Time, thank you. Miss Camilla, you can take yourself off mute.
Hi, Bobby. This is Camellia, recently moved to Nashua. I just want to thank the board members for doing everything they can. I know everybody's stressed out for the past 2 years. I just want to express my personal opinion, and I know Bobby and I talked about this. I just want this, I'm sure everybody else feels the same. I think everybody wants to do the right thing. I think everybody's adults, they have to protect their family, and just leave it up to people, and hopefully we get through this by end of February 28th and live our lives. And again, thank you so much and have a great day.
Thank you. Let me just see
Any other comments?
on this other page.
There are no more hands up.
Thank you. With that in mind, I'll close the public comment section, and before a motion to adjourn, just like to use privilege to say, happy Valentine's Day. You know, as one of the speakers said, it's been very stressful. We all know that it's been more of a nightmare than a joyride, but this weekend we get a chance to be close to our loved ones. Let's make sure that we keep that in mind. And I'm sorry, the Patriots are not in the Super Bowl. But other than that, I'd like a motion to close the meeting, end the meeting. I have a motion. Do I have a second? I have a second. Those in favor? Thank you. I'd like to thank everybody that participated, staff that did the work, and the public that was able to be here, give comments.